get diagnosed. And that's the problem, is most people are not getting diagnosed. Iron is largely stored in the liver. And so when you have a lot of iron to store, then the liver will store a lot of it. And then all of that excess iron will create a lot of damage. People that have hereditary hemochromatosis will often have high liver enzymes. They'll often have develop fatty liver. There's a 200 times increased risk for liver cancer. There's an increased risk for all cancer, creating inflammation, plaquing, strokes, clotting, atrial fibrillation. I can't think of like one health problem that I can't somehow link to hemochromatosis from explaining it and citing research.
Today, I'm very excited to have Dr. Sutton with us. Dr. Christy is a renowned chiropractor specializing in applied kinesiology and holistic health. She has dedicated her career to helping individuals achieve optimal health through a comprehensive approach that addresses the root cause of their alignments. In this episode, we'll discuss Dr. Sutton's journey into chiropractic care, a holistic approach to health, and dive deep into key messages of her book, The Iron Curse. Hello, Dr. Sutton.
Hi, thank you for having me.
So can you tell us a little bit about your background, your journey, and what brought you to learn chiropractic?
My background's a little bit different because I started into chiropractic when I was very sick. I was introduced to chiropractic as a patient when I was very sick with Crohn's when I was in my 20s, and I weighed 70 some odd pounds. I was very sick from Crohn's, and I was, trying to get better, and somebody recommended I go see this chiropractor. Well, they said go see this doctor. I didn't know he was a chiropractor, and so I went to go see Dr. Bandy in Austin, Texas, who's awesome. And he told me, you need to avoid these foods, gluten and dairy, and take vitamin B3. You basically have pellagra, vitamin B3 deficiency. And so I was already avoiding those foods. I had kind of put myself on an elimination diet prior to that to avoid foods that I knew caused pain, but I was still having a lot of diarrhea, which is common with Crohn's. And so I started taking the vitamin B3 that day, and I got the diarrhea stopped, and I within the course of the next couple months gained my weight back. And that was the beginning of me kind of looking differently at my health. And I think the general health paradigm and medical paradigm. And that was when I started to really look at, well, the environment and the environmental factors and triggers were always interesting before that. That was eye-opening because I realized, like, oh, I have been dealing with this easily treated condition for a while now, and nobody diagnosed me because it just wasn't within what they were looking for. And I started to see myself as like, maybe I'm not as broken as maybe like this medical system's broken. And then I finished my undergrad in microbiology and biochemistry, and I thought I might want to go to medical school and be a gastroenterologist. And then I worked for a little while in a hospital as an endoscopy tech, and I decided I didn't want to do that. I wanted to really work on, getting people healthy naturally and avoiding health problems without drugs and surgery. And every time I went to go to the chiropractor, I always felt so good. And I was like, that's what I want to do. And so finally I got the courage to just go ahead and do it. And I went to chiropractic school, and then met my husband. He's not a chiropractor, but I met him while I was going to chiropractic school. We got engaged, married, pregnant. And then I realized that my husband had undiagnosed hemochromatosis, hereditary hemochromatosis, because I started writing my first book, my genetic testing, defining your path to a personalized health book. And when I was writing that book, I was going through a lot of different genes. There's a lot of genes in that book, and they're all in the genetic detoxification report. And one gene that I wasn't really that familiar with, but I became more familiar with through writing that book was the hemochromatosis genes, which at that point in time when I wrote that book, I just included the two hemochromatosis genes. Since then, my new book, The Iron Curse, I included the third hemochromatosis gene, which is also in the genetic detoxification report. So, which you can create if you've done 23andMe or self-decode or anything like that. So I realized, oh my gosh, my husband has this. This is what's causing him to have liver problems, and then walked him through the steps of getting diagnosed. And that was much more hard and difficult than it should have been because it kind of goes back to this is not what the doctors were looking for. They kind of looked for everything else and dismissed this hereditary hemochromatosis thing. And then we finally got it properly diagnosed and everything, and his health improved. But then we later found out he had a pituitary tumor, which I think might have been um, at least partly contributed to by having hemochromatosis, because hemochromatosis, which I'm sorry, I haven't defined that yet. That's high iron. So if you have high iron, then high iron really likes to damage the body, but there's certain parts of the body that are higher on the list of being damaged. And one part of the body that's very likely to get damaged by high iron is the anterior pituitary gland, which was where my husband's tumor was. So he developed a number of health problems, Cushing's disease from that, and we had to have a couple of surgeries. And so that's kind of where I am now. And I wrote my book, The Iron Curse, and created all the workshops. So that's, I guess, the long story.
Yeah. And I also wanted to ask before we dive into the book is a little bit about applied kinesiology and your holistic approach. So why did you choose that path?
Yeah, I chose that path because the doctor that helped me in Austin, Dr. Bandy, that's the technique that he was doing and very good at. And I wanted to work with him and learn as much from him as possible. And so my first couple of years out of school, I worked with him and learned a ton. And he is just such a brilliant doctor. And so I just wanted to learn as much about it from him. Now, during chiropractic school, we did learn some applied kinesiology. So applied kinesiology really uses like a lot of muscle testing as kind of a window into the health of the body, the nervous system, all that. And so we did learn some of that in school a little bit, and then I took a lot of classes during school, outside of school, and to kind of learn more about applied kinesiology. And one thing about when you're in chiropractic school, there's like all these shiny things that are trying to get your attention. Like there's the applied kinesiology that you want to learn about, and then there's like the neurology that you want to learn about, and there's like all these different courses you can take, and you just don't have enough time to do it all. But they're shiny and sparkly, and you want to kind of do all of them. And so occasionally I would try to like go and learn about other new things, but then I always would come back to applied kinesiology because it just made things so approachable and got such good results. Um, and um, so yeah, that's why took that path.
Uh-huh. And in your clinic, do you mostly see kids?
Oh no, I do see some children, but I mostly see adults. Yeah. But
Mhm.
I see kids, I see adults, I see elderly,
Yeah,
everybody.
because I know you specialize also in the Malilo method. That's why I asked if
Oh
you.
yeah, yeah, yeah. So I took yes. Um Dr. Malilo, who is also a wonderful chiropractor that has contributed so much to the whole field of brain health, not just brain health for kids, but brain health for everybody's brain. I took all of his courses, and I use that some. I've integrated pieces of that within my practice. I don't practice exactly like him, or I feel like most chiropractors, maybe just most doctors in general, after you've kind of worked long enough, you kind of pick things up here and here and you kind of integrate them in. But yeah, I do try to help as many kids as possible to have healthy brains and hopefully um, really what Dr. Malillo is all about is trying to integrate primitive reflexes and balance the brain. And if you can do those things, then that's crucial. Um, but one area that I also have a lot of interest in, which I think the Malillo method maybe doesn't focus as much on, is figuring out the underlying cause for why people have these brain imbalances
Mhm.
and primitive reflexes. And that there's no one size fit all approach for that. Like my colleague, she had her 5-year-old daughter had hereditary hemochromatosis, and she had all these retained primitive reflexes that she shouldn't have had, and all this neurological issues, a lot of neurological issues, and they all got better when she was diagnosed and treated for the hemochromatosis. So sometimes I feel like we're kind of chasing around the problem rather than kind of zeroing in on what the main issue is.
Yes. So you see like kids who actually can't integrate the primitive reflexes because of the root cause of the problem, right?
Right. Hmm.
So in your book, you talk about the dangers of excessive iron. So what we spoke about what motivated you to write the book,
Hmm.
and could you elaborate a little bit about excessive iron?
Yeah, so most people that have high iron hemochromatosis have inherited a hemochromatosis gene, either one or two. You can get one or two. It depends on what your parents had. And there are some people that get high iron that don't have a hemochromatosis gene, but most people, they have a gene. And the population that's most common to have that gene is the Caucasian Northern European, especially the United Kingdom. It's very, very common there. And so what happens is people they have this gene and then they absorb too much iron, they absorb more iron and they get high in iron, and they don't always get high in iron, but they're more likely to get high in iron. And if you have undiagnosed high iron, then it is very toxic. It basically is creating all of this damage and oxidative stress and kind of like rusting out all of the cells in your body from top to bottom. But the main organs that seem to get affected first and most seriously is the liver is the most common organ to get damaged because iron is largely stored in the liver.
Mhm.
And so when you have a lot of iron to store, then the liver will store a lot of it, and then all of that excess iron will create a lot of damage. And so it's common to see people that have hereditary hemochromatosis will often have high liver enzymes. They'll often have develop fatty liver. There's a 200 times increased risk for liver cancer in people that have hereditary hemochromatosis because just all of the damage. Um, there's an increased risk for all cancers with hemochromatosis because high iron causes damage to the whole body. Um, the other part of the body that iron likes to damage is the heart, creating inflammation, plaquing, strokes, clotting, atrial fibrillation, abnormal heart rates. It can cause you to have higher resting heart rate, decreased heart rate variability. So just cardiovascular issues. Um, it can cause high iron will damage the brain, creating an increased risk for Alzheimer's, Parkinson's, bipolar, dementia, depression. Um, High iron damages the pancreas, causing diabetes, type 1 and type 2 diabetes.
Mhm.
High iron will damage the ovaries and all the hormone organs, the testes and the pituitary gland, and that will create infertility, hormone imbalances, you name it. A lot of joint pain is common. I see this a ton in my practice as a chiropractor, and so they'll often have higher risk for joint pain, like arthritis or even rheumatoid arthritis or gout because of um,
Mhm.
the damage that's done from having high iron. So a lot of digestive issues.
Mhm.
So, and an increased risk for autoimmune diseases. So There's really, I can't think of like one health problem that I can't somehow link to hemochromatosis from explaining it and citing research. Um, but it really is an iceberg disease that can affect everything.
Oh, wow. So what will be the first steps a person needs to do?
Well, the first step is to get diagnosed. And that's the problem is most people are not getting diagnosed. And really, if I'm being honest, the step before that, before getting diagnosed with hemochromatosis, the first step is to get screened for the genes. Because if you're screened for the genes and you're getting routine labs to check your iron levels, then you know if you're at a high risk for developing high iron and you know what your iron levels are, and then you can use those labs and genes to give you a correct diagnosis. And you don't even need the genes to diagnose hemochromatosis. You can just do it on labs. The genes just tell you if you have a genetic predisposition. And then once you get diagnosed, then the next step is you need to lower iron and get back in a healthy range and keep it managed there. And that there's the most common tool for that that's used in healthcare right now is removing blood. So a lot of people are unintentionally um, keeping their iron levels lower by donating blood routinely.
Mhm.
Some people cannot donate blood, and then they have to have like a medical blood removal done through a doctor's office or have a form that's filled out so that they can't have blood removed. So um, now there's other ways to lower iron that need to be known about and considered in addition. And I go through all of those steps in the iron curse. And so some of those steps are looking at diet. There are some foods that are going to increase your iron levels more than others, like red meat will increase your iron levels more than fish or chicken because there's more iron in red meat than fish and chicken. Um, and then there's drinking like coffee and tea. There's certain things that can decrease your iron absorption. And then I have a step where I talk about all the supplements that can help to decrease iron levels and like bind to iron and lower iron absorption and help heal up the iron damage. And so really there's a lot of different steps that people I think need to be aware of once they get diagnosed with hemochromatosis. But the most common way to lower iron when you have hemochromatosis is blood removal, because when you remove blood, there's a lot of iron that gets removed there in
Mhm.
the blood, which is why women don't tend to have as many problems as men because we're losing blood every month through menstruation.
Well, extremely interesting. Um, and what would your advice be in terms of keeping a healthier diet without donating blood?
Well, everybody's different. It's hard to say this is my advice, but if for some reason you tend towards high levels of iron and you can't have blood removed, either just because you can't donate blood doesn't mean you can't have blood removed. Like, um, you can get a doctor's order to have blood removed. Like if you have an infection or something that stops you from being able to have donate blood, you can still have blood removed. Either go to the doctor's office or have the doctor fill out a form so you can have blood removed through a donation center. But some people, they cannot donate blood or have blood removed to lower iron because they don't have enough healthy red blood cells or hemoglobin.
Mm.
And in that case, then looking at the other options are to get really aggressive with the diet and supplements. And the dietary things that would help lower iron would be, um, definitely limiting red meat. If you're going to eat red meat, then take the supplements with the red meat, drink green tea, drink coffee or something with that to decrease the iron absorption. But I'm not saying limit protein, is I don't think you necessarily need to do a vegan vegetarian diet. But if you have high iron, you're trying to get it lower, then eating a lot of red meat's not going to help you reach that goal. Um, And if you do eat red meat, then pair it with other things like curcumin or supplements I mentioned that can help lower the iron levels, because that can be really effective. And then, you know, really, if you can't have blood removed, you're limited to the diet and the supplements. And that for some people is enough to keep them in a healthy range. But for some people, it's not enough. Like for some people, they just absorb and have stored so much iron that they really have got to figure out a way to be able to remove blood to get the iron levels down quicker. But if you're even, this is an important point. Um, when you only use blood removal as the tool for lowering iron, and you don't really look at like the diet and supplement piece and lifestyle piece, like not drinking alcohol, because if you drink alcohol, you're going to absorb more iron. Don't take high doses of vitamin C on a regular basis because that's going to increase iron absorption. If you don't look at the other options in addition to blood removal, like the diet and lifestyle things that I talk about in the book, then you are limited to only like being able to lower iron with blood removal, and you're going to have a harder time getting your iron levels down and maintaining them down in a healthy range. And this is where some people, it takes like a really long time for them to get down into a healthy range, because they're only using the tool of blood removal and they're not looking at these other tools, which you can use every single day to help decrease the risk for having high iron.
Oh, I think the major problem, for example, in the UK is that, people will have difficulties getting diagnosed.
I I have heard a lot about that. Being in America, I'm pretty ignorant to what it's like to be a healthcare provider in the United Kingdom, but I have heard that from healthcare providers and people in the United Kingdom. And I think that's a really good point. And I'd like to say a couple things that maybe can help with this diagnosis. One is you can get direct to consumer genetic testing done through like 23andMe, and then you can know if you have inherited a hemochromatosis gene. You can use your own resources to get a couple $100 genetic test, and then you can figure out if you have a hemochromatosis gene. And if you have a hemochromatosis gene, then now you can take that to your doctor and say, hey, I have this gene. Can we order these iron labs, which I lay out in the book what labs you absolutely need to have to diagnose hemochromatosis. And then you can understand, okay, if my iron saturation's over 45 and I have a high ferritin, then I have hemochromatosis. And then you can really advocate for yourself. But I don't know how it is in the United Kingdom. In America, there are ways that patients can order labs themselves and go outside of the doctor. And so I don't know if is that available there?
And not really.
No. Okay. Well, then that's not an option. But then the other option is go to get your genetic testing done, give it to your doctor, educate yourself, especially if you have one of these genes, know what labs you need and ask for them, and then, hold your doctor accountable to helping you. And then if you can donate blood and you have, an issue, then donate blood. If, look at the supplements and lifestyle and diet, and there
Exactly.
are things you can do. It's not easy. It should be easier. And I deeply hope and I wish that the medical doctors all around, especially United Kingdom and America and everywhere else, get more educated on this, because um, it's costing the healthcare system so much money to treat people for all of these problems that are really symptoms of undiagnosed root cause high iron.
Exactly. Yeah. And can people order the genetic tests directly from you and work with you? Remote?
Yeah, so well, yes and no. So um I don't sell the 20, like you have to go, I don't have any affiliation with any genetic testing company. The Get whatever genetic testing you want. Just make sure they have the hemochromatosis genes. If you do 23andMe or self-decode, then you can, I know for sure 23andMe checks at least 2 out of 3 of the hemochromatosis genes all the time. Then you can create a genetic detoxification report at geneticdetoxification.com, and then that will give you not just the hemochromatosis genes, but also a lot of other important genes that are very important for health. And I don't have time to go through all of them. But yes, so, and then, I have educational workshops and I, can talk to people and patients and try to figure out, how to navigate this issue that certainly doesn't have to be as hard as it is.
Yeah.
But it is a genetic issue for most people. So if you if you take it on and you figure it out, then you can really do a great service for your family, your kids, your parents, your siblings, your cousins by breaking this generational potential health problem.
Yeah. Thank you so much. I've learned so much, and I'm hoping more people can learn about it and be in touch with you.
Thank you. I appreciate it.